It's really neat when he just sits there and he's just staring up and gazing at you while you're feeding him. It's a very unique bond.
You don't need to take anything with you, as long as you've got yourself and your boobs, and yeah, it's really easy.
It's a real big bonding experience.
It's free. Your food is free.
I think it's a cultural thing with islanders that they always think that breast is best.
It just helps me feel more like a mother.
Breastfeeding is one of the greatest gifts women can give their babies and themselves. Breastfeeding exclusively for around the first 6 months, and then continuing once baby starts solid food until at least 12 months and beyond, will provide your baby with the best start in life.
It's like you have this gift for kids.
In this DVD, we'll follow 9 women on their different breastfeeding journeys. We'll provide tips to successful breastfeeding, and we'll hear about the realities of breastfeeding for women and their families.
People think it's going to be perfect and beautiful the whole time. Oh, my baby, just having a nice feed. But it's actually hard work, and you just have to remember that it's worth it. It's the best you can do for your baby, so stick with it.
Breast milk is the healthiest and most nutritious way for babies to begin their lives. There is nothing better.
We have a lot of allergies and food intolerances in our family, so for me it's really important to exclusively breastfeed. It's just really the best thing for them.
Breast milk helps protect babies from tummy upsets, respiratory and ear infections, and reduces the risks of diabetes, obesity and cot death.
Babies that are breastfed, you know, they get fewer infections because of that antibody transfer.
Push the baby's bed into mummy and daddy's room.
Not only is it healthy for the baby, it's healthy for you, lowering the risk of breast cancer and ovarian cancer. Breastfeeding may also help with weight loss, and it strengthens the bond between you and your baby.
Breastfeeding's a nice cuddle time, even sometimes in the middle of the night when you're absolutely shattered, and it's just the two of you. It's really nice.
Women have been breastfeeding their babies since the beginning of time. While suckling is instinctive, babies may need time and practice. And the more we know, the easier the breastfeeding experience is for mother and baby.
Because in that whole first, 6 weeks is when you're really establishing breastfeeding.
Before your baby arrives, it's a good idea to start thinking about who will support you and your new baby, so you can concentrate on breastfeeding and getting the rest you'll need. Nova Lee has just started her paid parental leave. She's having her baby by herself, but has a lot of support from her whānau.
I'll be moving in with my niece this weekend. At the moment I'm by myself. My sister works, that I live with here, she works all day and didn't want to be alone with the new baby. So my niece has got a baby as well, and it just seemed prudent to move in with her, plus two, my sister here and her partner are smokers, and I didn't want to exactly expose myself or my baby to that.
If you are a smoker, you can still breastfeed in a smoke-free space, but it is best for your baby and you if you try to quit as soon as possible. Talk to your midwife or doctor, or phone the quit line on 0800 778 778 for support. Nicotine replacement therapy doubles your chances of quitting and is considered safe to use while pregnant or breastfeeding. When Nova Lee found out she was pregnant, she wasn't going to breastfeed because her sisters didn't.
My sister just gave up straight away. Ouch, it hurts, nah, she's going on a bottle.
But she changed her mind after talking with her midwife.
I just thought, well, if I can do it, why not? Yeah.
Varna and Stanley are also about to become first-time parents, and they're finding out as much as they can before their baby comes home.
We've heard a lot of stories that it sometimes hurts, but if it's the healthiest way for baby, then that's what we're going to choose. Yay! Dad rocks, eh, honey?
I don't know much about breastfeeding. I wish I was able to know more. That's why we're attending these antenatal classes.
If you learn the right way of doing it, you're less likely to have nipple injury, which is one of the main causes for stopping breastfeeding. I mean, of course I don't mean literally, guys. You need to just turn baby's mouth more towards the nipple, like that. That's right. Now you show her how to do that. You take that over.
Here you go.
There you go. So here's the baby.
Tuck it in.
We've got to get our bags packed.
Lindsay is looking forward to the birth of her second son, and she's having some last-minute nerves.
Good folding.
I breastfed Jack till he was a year old, and that's what I'd like to aim for this baby. And it's actually quite strange, I've all of a sudden got really nervous that I've forgotten how to. So I think I'll have to dig out the books and just refresh.
We just need a baby now, don't we? Nan did it as well.
Lindsay gets a lot of support from the women in her coffee group.
Because I've suddenly all of a sudden got nervous that I don't remember how to do it.
Oh, it honestly is like riding a bike, eh? There's a few, there are speed wobbles.
But you didn't see me the last time I rode a bike.
It's only really the first 3 or 4 weeks that you kind of have to actually help them, and then they just start latching on by themselves. Yeah. They just kind of know what to do.
Every time you sit down to breastfeed, you always forget to grab a glass of water or the pillow's a little bit further than you want and it's out of reach, and you feel vaguely guilty about the fact that your husband's waiting on your hand and foot. And I think if he had been a little bit more selfish and a little bit more, could you just stop asking me to get this and that and the other thing, it would have made me feel quite alone.
Novalee is 10 days overdue, and she has some last-minute questions.
After my baby's born, what happens then?
So the baby will be brought out onto your abdomen and placed on your chest. Your temperature will keep the baby warm, and then the baby will be able to bond with you, have skin to skin, and that will help latch onto the breast.
She's coming.
Oh, look, it's come out now. Baby's coming out now.
Newborn babies are placed straight on their mothers when they're born to help with bonding and attachment. Skin to skin is the best way to keep babies at a perfect temperature, and it will encourage baby Deanna Lee to try her first taste of breast milk. Lindsay went into labour earlier this evening, and her second son Ben was born half an hour after arriving at the hospital.
It is.
Pretty sure it's a boy.
Very surreal. Yeah, I don't know, it's just an amazing feeling, really, to be handed a baby.
Newborn babies will start looking around for food, usually within the first hour.
She's sort of giving you all those little messages that she'd like to start going to the nipple. If you turn her over, just turn her over tummy to tummy.
Do I need to support her? I'm just so scared.
She'll be alright.
Always remember, tummy to tummy.
Tummy to tummy, huh?
Now, can you see that? See how she's opening her mouth and she's starting to suck her tongue? She's really exploring you, getting to know you, that smell of you, and that's the essential thing for her to start breastfeeding.
Breastfeeding is so instinctive for babies that if left, they will crawl towards your breast and latch on by themselves.
Can you see how that was a beautiful wide open mouth? Now, can you see that tongue at the bottom? Look at that. And you can feel that suction?
Yeah, I can.
Okay, and it's that lovely rhythmic suck, 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 suck. And she'll rest for a few seconds. And she's done that all on her own, you know, getting there all on her own. Now, it's really important over today and the next couple of days that she just feeds whenever she needs to feed, okay? Because the colostrum, which is the milk you've got there at the moment, which is a nice goldy colour, it's not high in volume, okay, but it's high in calories and goodness and antibodies for the baby. It protects the baby from bugs, okay, from infections and viruses that are around. I often say to ladies, it's gold, it's as valuable as gold. And if you touch his head, you touch his head, you'll think...
Although Lindsay breastfed her first son, she's finding that all babies are different.
So hand right around the base of his neck, around his shoulders, sitting his chin on the areola and nose to nipple, and then bringing him onto the breast rather than the breast to him. Hold on. It's really keen now. Now bring him onto the breast. That's the story. Sometimes it can take a couple of good latches to get him going properly.
So different from Jack. Jack just went on and didn't come off.
Okay, baby. Well, it's a very rapid birth for this one, so now that looks like a good latch little guy.
Yeah, he's moving it.
Now, how's that feeling?
It feels good. It feels fine.
Sort of a deep drawing
Yeah.
sensation rather than a nipping biting.
Yep.
So you can see his jaws moving right up to his ear, and sometimes the ear moves. And also, if he's latched on well, his little bottom lip will be tucked down. You can see now his little bottom lip is not tucked down. So do you know how to safely delatch a baby? See, now he's on your nipple.
He's on properly. Come on, come on.
Lindsay is exhausted after the birth and needs a rest. So Tony is bonding with his new baby, skin to skin.
It's nice. It's an amazing feeling, actually.
He's got bigger feet too.
Look at his big toe.
First-time mum Nova Lee is 12 days overdue and has been induced. Her baby's heart rate dropped in utero, so as soon as she was born, she was placed skin to skin on Nova Lee, and she's doing fine. In fact, she's hungry. You'll know your baby is hungry by watching for her hunger cues, which include licking lips, sucking noises, sucking hands, or turning her head from side to side.
When she's making that noise, it's an indication that she's not on properly, because you can hear.
If you miss these hunger cues, your baby will cry. Try not to let it get to this stage, or she'll be too upset to feed well.
Yeah. Not really much of a noise if they're latched on properly. No sort of clicking sound or sucking like that, kind of quiet. And if cheeks shouldn't sort of dimple at all. If you're sort of seeing her cheeks dimple, you know she's not on properly, she's just sucking the end of your nipple.
Okay. So you don't need to give her anything else while we're here?
Just the colostrum, and just feeding her often will help bring your milk in and help bring in a decent supply.
It just seems strange that she was fed right up until, with the from the placenta, and now she's appears to have taken to something so naturally.
Just slipping off a little bit. She's having a think about it.
The baby will be feeding on the fat-enriched colostrum for the first 2 to 3 days until your milk comes in.
It's an interesting feeling to know that it's not just about me anymore. Something's dependent on me for life, for food.
Single mum Nova Lee is home from the hospital and things are going really well.
Taja is 10 days old, and I found breastfeeding quite easy actually. I've not had any pain, nothing. So it was just like, oh my goodness, I am capable. I can breastfeed. Auntie, what do you want on your toast?
I've got my support, my niece here all the time. I think in my first couple of nights getting home from the hospital, just being so knackered, and I could hear her crying, but I was like, I'll get up soon, I'll get up soon. And then Charlotte would come in, whether it was 10:30 or 11 at night, and just mooch her until I was like fully awake.
I think the biggest support needed for girls, not just like Nova, but like myself, is family. It helps. It makes it all easier. And the fact that you know that at the end of the day, partner or no partner, there's still people there that are going to hold your hand and tell you that everything's okay and that you're not doing anything wrong. The more support you have, the better. Makes it easier on yourself and the baby.
Nova Lee has been proactive about getting as much information on breastfeeding as she can. Today, she's having her latching technique checked with a lactation consultant at her local plunket.
It's important to get yourself comfortable. A lot of people get themselves in very odd angles. So have yourself comfortable, then bring your baby to the breast. Not you leaning over to the baby.
A good latch is the key to successful breastfeeding.
Good girl, she's starting to really want it now. Get her level with your breast. Yep, great. And if you can just turn her to face you a little bit more, she's just leaning out that way. You want her rolled in so she's tummy to tummy. That'll be lovely.
Bring her in close, but let her head tilt back so her chin touches the breast and her nose lines up with your nipple.
Could you just tilt that nipple up to her nose a bit and start the latch so she gets a nice deep latch underneath the nipple. So you just sort of make a little brushing down movement. That's perfect, that's great.
Gently tickle the top part of baby's lip with your nipple or areola. Wait for baby's wide open mouth, making sure her tongue is down. Then quickly bring baby up onto the breast so her bottom lip is pushed back to create a suction cup. Let baby take in a large mouthful of breast, not just the nipple. She'll take more of the bottom part of the areola than the top. When baby feeds, there should be no pain. If there's any pain, then take her off by inserting your finger in the side of her mouth to break the suction and start again.
Now that looked good. How does that feel?
Yeah, that feels better.
Because she's so newborn, she needs a bit of time to learn and practice. And look at her. She's great.
Begin the latch with your baby's chin resting on your breast. Your baby should take your breast and nipple deep into her mouth. When she feeds, you should feel a tug, but no pinching or pain. Breastfeeding will be comfortable for you and effective for your baby. Every woman is different, so find a breastfeeding position that suits you and your baby. The same guidelines for latching can be applied to different breastfeeding positions. This is the rugby hold, and women who have had caesarean births find it particularly comfortable.
And using this bit to roll down again.
Get your hand out of
Good
the way.
girl. Oh, that looked great. How does that feel?
Well, that's quite comfortable. Yeah.
Now, if you could just take that thumb away, just so you don't put any pressure on your breast so you get blocked ducts.
Lindsay and her new son are back from the hospital, and the whole family are getting acquainted.
Well, I've got 2 weeks off. Yeah, I just look after Jack and give Lindsay a chance to get familiar with Ben, the new one, and rest, and yeah, just get used to him myself, I guess.
Ben is 9 days old now, and breastfeeding's going well. He's still relatively sleepy during the first side, so he changes nappy, and Jack always has to have a cuddle. So we do that in between sides, and that usually wakes him up for the second side.
Your milk takes 2 to 3 days to come in, and it's normal for babies to lose a bit of weight at first. Your baby should be back to his birth weight by day 10 to 14. One of the ways you'll know if your baby is getting enough milk is if by day 4 he's producing at least 6 wet nappies in 24 hours.
I've basically been told not to worry too much because he's hardly lost any weight at all, and we've got plenty of wet nappies.
Newborn bowel motions will change in the early days from the tar-like meconium to a brownish colour on day 3, and then to a yellowish-greenish colour by day 5.
It takes time, but I think you get out what you put in as well. I think it's obviously a natural thing, so it's a good thing for mum and baby to do. Lindsay breastfed Jack for the first year. It's definitely well worth it.
Hello, come in.
There are lots of places you can get help for your breastfeeding if you need it. Lindsay is getting advice from her midwife as she does her regular visit. Women often worry that their babies aren't getting enough milk, but if you feed on demand to begin with, your baby will tell your body how much milk to produce.
The volume of the newborn's tummy is it's tiny. And then the volume of the tummy stretches to about 25 mils. So again, on day 3 to 5, they're still only having small volumes. And then on about day 10, we've stretched to about now. Just, nose to nipple and bringing him to the breast, right?
Ben has been feeding constantly for a few hours in the evening, and Lindsay's wondering if that's normal.
That cluster feeding is really normal newborn behaviour, and the time that he's doing it is normal too. It's the evening. It's always when you're at your busiest, and babies are tanking up for the night, basically.
Varna and Stanley are also home with their new baby.
She's about 6 days old. Yeah, it's been a joy to have. The breastfeeding's going quite well, and the family's enjoying her here. Yeah, they will help out. First few days, I did have sore nipples, but I was told that just keep feeding baby. But I think it was just all the techniques that I was doing that made my nipples sore.
Nipples can be a bit tender in the first week as they get accustomed to breastfeeding, but they shouldn't be sore. Make sure you're latching baby on properly and ask your midwife for help.
Daddy's going to school now.
Stanley right now is doing a bachelor degree in human science. He usually leaves in the morning quite early. He's not here to help out. But then my parents are here and so are my sisters, and they help a lot. I had no idea that breastfeeding will take so much time, how often you have to do it.
Eating a balanced diet and getting the rest you need is important for a breastfeeding mum, so your body can make milk for your baby.
To make sure I get enough rest, I usually sleep when she does. And then once she wakes up, then I usually feel that I've got the energy to keep up with her. And so when she's sleeping, I'm sleeping as well.
You think that it should come really naturally and that it should be something that's just really easy, that, you know, you've got breasts, why can't you breastfeed?
In this section, we'll go through some of the most common breastfeeding difficulties and some tips for overcoming them.
With my eldest daughter, I got really, really bad cracked nipples, and it was just excruciating. When every time I fed, I would just dread it, and it was incredibly painful, and often they bled as well. My midwife was really helpful the first time, and this time around I got a lactation consultant, which was absolutely invaluable, and she just made sure I was latching correctly and everything.
Breastfeeding shouldn't be painful. If it is, take your baby off and relatch her. If the pain persists, ask for help.
They actually heal incredibly quickly because there's a lot of blood flow in the area. So the best advice my midwife said to me was, she said, Michelle, you know, I promise you it gets better. You just have to hang in there, keep feeding, and as long as you're latching correctly, it will get better really quickly, and it does.
Marcia also had a sore nipple in the first week, and it quickly developed into something more serious. She's had a lot of help over the last 4 months from her midwife, friends, family, and a lactation consultant.
It started with a bad latch. I really, as a first mum, as a new mum, I really didn't know what I was doing. Thought, how hard can it be? Throw a baby on the boob, bang, you're done.
A bad latch can be painful and also means that your baby will not be feeding as effectively as they could be.
Every time he fed on that side, I was in agony. I had tears in my eyes. So I felt like a bit of a failure. The next morning I sought some help from my midwife, and she was able to give me some advice on how to start the healing process. There was some infection there, and I had to have some treatment for that, antibiotics and antifungal treatment. So in hindsight, I wish I'd got help earlier.
Our advice to mothers is, even if there's a little tinge when they're breastfeeding, take baby off and put baby on again.
When your milk comes in 2 or 3 days after birth, your breasts may be engorged to begin with.
One of the challenges that I've had is that on my left breast, she doesn't tend to feed on that one as much as she does with her right. And usually the left breast will get hard and it becomes quite sore. So I have to kind of like express it out. It just gets pretty painful sometimes.
Some babies will be able to empty both breasts every time they feed. Others will be full after one. Although babies often prefer one side, it is important to have them feed on both sides throughout the day to avoid getting blocked milk ducts.
I have talked to my midwife about it. She was saying that if things like that occur, then just massage it every time I'm in the shower. So that helped.
Can you see your pom-poms?
Emily had help from her mother when she discovered a lump in her breast.
She said it was probably a blocked duct, and so I had a bath, and then I sat down on the chair, and Mum put a hot flannel. I put a hot flannel on my breast, and Mum showed me how to massage the duct. You just kind of push it gently and push it down, and then when I was feeding, I would push on the where the blockage was. So try and help it, you know, just gently. You alright? You alright? Just try and help that milk come through.
Come and sit down over here, sweetheart.
If left untreated, a blocked duct can lead to an infection of the breast called mastitis, which is what has happened to Lindsay.
It hurt quite a bit to feed in the middle of the night, and obviously half asleep you don't really think too much about it. I just wondered if Ben was latching wrong, and it wasn't until about mid-morning that I noticed a small patch of red. When I spoke to Healthline at about, say, I think it was about 11ish, it was probably about the size, it was about an old 50-cent piece. By the time, just before I went to the doctor, I checked again and it had doubled in size. By the time I actually saw the doctor about an hour or so later, it covered almost a quarter of my breast. It was quite red, and it was actually starting to snake up into my armpit. I had to think about 2 lots of antibiotics the day that I saw the doctor, and basically was feeling heaps better within a couple of hours.
Mastitis can develop very quickly, so keep an eye out for any lumps or red patches and avoid wearing tight tops or poorly fitted bras. If you think you may have mastitis, contact your GP.
The best thing is just to keep feeding. That was the main
That was the hardest part.
Yeah, I just kept breastfeeding, kept massaging it.
Yeah.
Johnny got in the jungle.
At different stages of their development, babies will suddenly want to feed more frequently. This is usually a growth spurt.
The way I can tell when she's having a growth spurt is she just feeds a lot. And she's a bit grizzly as well. And then often I'll think, oh, I wonder if she's having a growth spurt, and then she'll get weighed and she's put on like 400 grams in a week or something. And I think, oh yeah, it was.
If your baby is going through a growth spurt and feeding more often, you don't need to top her up with water, formula or food.
She feeds more, so my milk supply increases. She's managing my breasts, which are kind of her breasts now. Hey.
Betty's toddler has a new baby sister who was born by caesarean 3 weeks early.
I was in hospital for probably about 4 nights, and found it really hard because the milk supply was really slow, and so I almost kind of gave up, kind of thinking it was me with the low milk supply.
The baby was dehydrated, so the paediatrician started her on formula in the first few days.
That's good. Are you comfy like that?
Very. When I was in hospital, baby kept crying, so we used to always top up with formula. And then I had a visit from the midwife who actually informed me, okay, we'll try and keep her on the actual breast as much as you can, which I did. And every day, regardless of how hard it was and the baby crying, eventually the actual milk supply came. So the perseverance of putting her on the actual breast made the milk flow.
Oh, isn't that fabulous?
Betty's baby is now gaining weight and thriving.
That's so good that you've gone, totally onto breast milk, and for that little bit of a rocky start at the beginning, suckle, lots and lots of suckling, and then that milk really doubled in supply, and we got a lovely baby with lovely weight gains that was happy and settled. Yeah, it was great.
It's good for mum and baby to get out of the house for a change of scene. Today, Michelle, her husband Kim, and their 2 girls are spending the day at Auckland Zoo.
I can remember the first time, my first trip out the house with 2 children. I think she was maybe 6 or 7 days old, and yeah, it was just lovely. I remember sitting in the sun under the tree on the beach and feeding her, and it was just, really easy.
Breast milk is portable and makes feeding baby on the run simple.
I feel completely at ease breastfeeding in public. It doesn't bother me at all, anywhere, anytime, any place. I don't find people look at you or stare at you or anything, they might just sort of glance at you and think, oh yeah, she's feeding, and if anything I get sort of a few smiles, people go, oh that's lovely, a little baby. So I generally double up 2 layers, so singlet underneath and one over the top, so I can pull one down and one up and feel like I'm sort of, pretty covered up, and just easy access really, it's the best way.
Breastfeeding is a natural, normal, everyday activity, but some women might be shy at first to breastfeed in public.
A quiet place like the reserve or park, I never feel shy about breastfeeding. But in supermarket, that's once just in Park and Save, my baby just hungry and wants to feed, or wants to be fed, and that time, I feel shy about it, but I still did. Nobody said anything about it. I think probably people think it's natural because baby is hungry. I can't just let him wait just because I'm shy.
Baby Rosa is 3 months old, and tonight Michelle is going out without her.
It's my husband's birthday today, so we're mum's babysitting and we're heading out tonight. Yeah, going out on a date. Very exciting. It's so important to get out without the baby. It's really nice, and I think it's quite good to sort of retain your own sense of identity and feel like you've got a life outside, you know, like sort of a bit separate from being a mother. And it's quite intense that first little while. You need to be there the whole time just in case they need a feed. After 9 long months of pregnancy, it's quite nice to go out to dinner and be able to have a glass of wine or 2. I've got some milk that I've expressed, so if I have more than a couple, I can just give her that feed in the middle of the night when she wakes up.
Alcohol passes through your breast milk to your baby, so you should avoid it, especially in the first month while you're getting your breastfeeding established.
So I've got some milk for Rosa that I've expressed.
Drinking alcohol can lower your milk supply, and it might make your baby irritable, unsettled or sleepy, and unable to feed effectively.
Fill it with really hot water and just sit it in it.
If you do have 1 to 2 drinks, avoid breastfeeding for at least 2 hours afterwards.
See ya. Bye.
Being a new mother is exhausting. Your body is recovering from the birth, and at the same time, you're on call night and day feeding your new baby. You'll need all the support you can get.
I've been trying to keep the pressure off Lindsay a little bit and do a few dishes here and there and just try and keep the house a bit tidied. I put on washing and hang out washing and try and fold it and simple things like that, I guess. And just try and help mummy out as much as I can.
Tony's been really good. He will often look after Jack while I'm feeding Ben, or often does the nappy change and get some breast.
Here's your lunch.
It takes a few days for your milk to come in, and during this time, some women experience baby blues, so support is particularly helpful.
Just keeping him entertained and just keeping him off mum's case a bit, so then mum can look after the new baby and get the new baby settled and into a routine and into the breastfeeding thing.
Good girl, baby.
Varna also has a good support team, with Stanley and her family in the house.
I'm always the one who calms baby down before she breastfeeds. Like, if she's crying and stuff, I'd calm baby down so that she'd breastfeed properly. Good girl.
Varna's finding it hard being on call all the time.
Night feeds gets hard sometimes because you're pretty tired and you have to force yourself to get up. But Stanley gets me to wake up and asks me if I'm alright. It makes my job much easier to feed her. Once she's on there, then she's practically fine, and then not long after that she's dozing back off to sleep, and then you can doze back off to sleep yourself.
It's just a joy, you know, watching Varna breastfeeding baby, and also the support of her husband, and you see the bond in between mother and child, having this bond of breastfeeding, and now I'm getting sorry, it's just a joy.
Establishing a breastfeeding routine can take 6 to 12 weeks, then it's usually a lot easier. Lynn's twins are 7 months old, and the strong family support during this time was essential for her and her boys.
Sometimes I was stuck with feeding. If I feed them both, and I have no hands to do anything else. And I think the most challenging thing would be after the first 3 months, it was too time-consuming.
It takes 1 whole hour to feed both, feed them and clean and changing. They wake up every 2 or 3 hours, so it's like always preparing a war, you know. If your enemy attack, you know, in 1 hour they come back again. And yeah, a lot of repetition.
My husband helped me a lot in the first 2 months. He wake up with me and he change the nappy. He just support me.
It's very important for a new mother to get support from the family. They need to rest when the baby is sleeping. It's not like they're lazy or being lazy, you know, refuse to do anything else, but they do need that time.
During the daytime, my mother-in-law helps with everything. She cook every meal.
very delicious food for me. It makes me so healthy. And also she helped with the cleaning. And sometimes help me to look after babies as well. If I have no support, I can't make it.
Helping out with the care of the new baby also gives dads and support people the chance to bond with the newest member of the family.
Although I have been expecting them for months, but when they were born, I don't feel close to them, you know. I mean, maybe emotionally. I know I should be. I'm supposed to love them, but I don't feel that connected. And when I began to feed them and clean them, the more I look after them, the better I feel. And now I feel so happy, you know, so proud.
Support can come in many ways, from friends and family, your well child nurse, lactation consultants, midwives, and the support of women in the community. Emily goes to weekly meetings with other breastfeeding mums at the Latching League.
He's number 4, so of course I thought, I just pop him on and get on with whatever I have to do. I think I would have given up, actually, if it hadn't been for the fact that Andrew had 4 weeks off work and he could run the household and, take the kids to school and do the washing and cook the meals and all of that, and I could just sit on the couch and concentrate on getting things right with him. And we did.
Being around a breastfeeding woman at Latching League, but also I go to my coffee group through my antenatal class, and I've got quite a few friends who are breastfeeding. I think that's an invaluable source of information because there'll always be someone else who's had the same thing or has got some ideas about ways to manage it.
More and more women are making the decision to continue breastfeeding when they return to the workforce. Marama has 6 kids, works 3 days a week at the office and 2 days at home, and she breastfeeds her youngest daughter Taina, who is 8 months old.
I went back to work when she was very young, about 8 weeks old, and lots of decisions. Of course, there's always the financial reason. While I'm at work in my office or away from her, I just have to express, and it's normally twice a day. Express milk for her, and that's stored, and then she can have that when she goes to care.
We've had many women working here who have either had their babies in here from time to time or just withdraw a couple of times a day to express, and our fridge is often full of little zipped up packs, and that's breast milk that's going to be taken home.
Here I have a nice little quiet room that's private and lockable, and I can express, and that's fine. But I've sat in work cars in the car park, in between meetings. You just do what you have to, when you have to keep it going.
Some places of employment have written breastfeeding plans. If your one doesn't, ask your employer about breastfeeding breaks and flexible working arrangements. Employers must provide women with breaks to breastfeed or express where reasonable and appropriate. Start planning early. A good time to approach your employer is when you talk about paid parental leave.
There has to be communication with whoever I'm responsible to, my manager. You do have to be quite clear about what your needs are.
Early childhood centres can also support your breastfeeding.
Thank you, you're such a good help.
Marama provides expressed milk for Taina to have while she's there 3 days a week. Breastfeeding helps keep the bond between working mothers and their babies strong.
This breastfeeding is one way of trying to make it up to you a little bit. Hey, darling. Just the eye contact with her is really important for me as well. And I want to be the most important person in her life. I want her to trust that I can give her what she needs, and so continuing to breastfeed is, for me, I hope, a way of giving her that.
Returning to work after having a baby is always a juggle, especially when both parents work full-time. However, there are many ways working women can continue to breastfeed.
I never thought of giving up breastfeeding to return to work. I always had in my mind that I wanted to be able to do both breastfeeding and work, and I think it's really important that women can have that opportunity. Hey, Han, I might have to get you to grab him shortly, and so I can finish getting ready.
There you go. Marcia works at a busy South Auckland health clinic, and her son Rex will come in with her until he's 6 months old.
I don't think women should have to give up breastfeeding to go back to work.
Hey, how's it going?
It's not just because Marcy is a GP. We've done it with other women as well. It puts such a totally different dynamic on your workplace. I mean, in the morning it's a scramble on who gets them.
I start work at 10 o'clock in the morning, and I have patients scheduled in with me from 10 o'clock onwards. So usually I get to work a bit early, about 9:30, 9:45, so I can settle him in, give him a quick feed if he needs a top-up from breakfast, which he often does, and then I just start working. And
we don't book her solidly because he is demand feeding. It's really when he's ready, he gets fed.
It's really cool. The girls all really enjoy having him around. It's been really awesome having him here.
Well, before that patient gets here, I'll throw him on. We'll give you a quick top-up, darling. Look at you munching out on your hand.
It makes sense to us as an organisation to have, you know, the best employees and to be able to retain them. And, you know, if people are getting that satisfaction at home as far as their personal lives are concerned, then that benefits us as an employer.
Bringing your baby to work doesn't have to mean that you're not working. You can still be very, very productive. It just means everyone that's around has to be sort of on board with that kaupapa, I guess, to make it work. Then there's no reason why it couldn't be done elsewhere.
Rex is now 6 months old, and although Marcia will continue to breastfeed him until he is at least a year old, his time with her at work is coming to an end. Today, Marcia's work colleagues are throwing him a party to celebrate their time with him.
Oh, it's kind of mixed emotions. Part of me feels happy that he can now have some time away from me and spend some more time with his dad. And then there's another part of me that's sad. It's, you know, one step away from him being my little baby, but that happens.
My husband and my mother were saying, oh, put her on a bottle, for crying out loud, look at you, put her on a bottle. But I knew I would get there and that it would be worth it.
It was hard at the beginning, but it gets easier as you go along.
It's really nice. It's just so easy now.
I do enjoy breastfeeding. You know, I really thought that I wouldn't, but it helps you to bond with your baby.
I'd never considered not breastfeeding. It's always just been something that I've done.
I'm really glad that I breastfeed the babies, and my husband really envy me.
Just knowing that you're nurturing the baby in a really good way.
Stick at it. You know, get the support you need to make it work, because it is the best thing for your baby and for you.